routine mechanics in aligner therapy, extraction, and non-extraction cases. Welcome everyone. Today we're exploring routine mechanics in orthodontic aligner therapy, both extraction and non-extraction cases. Clear aligners have become one of the most popular treatment options in modern orthodontics. They're discreet, comfortable, and digitally planned. But here's the key question. Are they as predictable as we think? Let's find out. In today's episode, we'll dive into one of the most exciting and fast-evolving areas in orthodontics, clear aligner therapy. From simple crowding cases to complex Class 2 and Class 3 malocclusions, aligners have changed the way we approach treatment. But are they foolproof? And how do we manage extraction versus non-extraction cases? Let's break it down. Clear aligners have changed orthodontics, but are they as predictable as we think? Let's dive into the science, the challenges, and the strategies behind extraction and non-extraction treatments. Digital tools like ClinCheck give us detailed simulations of how teeth might move. But remember, digital models don't equal clinical reality. Tooth movement depends on biology, on bone density, periodontal ligament response, and patient compliance. As orthodontists, we must balance technology with biology in every treatment plan. Digital tools like ClinCheck give us beautiful simulations of tooth movement. But remember, teeth don't move digitally. They move biologically, through bone remodeling, ligament response, and cellular activity. That's why clinical outcomes don't always match the screen. Clinicians must be honest. Digital simulations defense guaranteed clinical results. Patients need to know about treatment timelines, compliance with elastics and aligner wear, possibility of refinements and attachments, and retention after treatment. At the initial consultation, it's essential to set realistic expectations. Patients must understand that aligner wear requires discipline, 22 hours a day, with elastics when needed. We also need to explain treatment timelines, possible refinements, and the use of attachments or auxiliaries. Discussing retention from the very beginning builds trust and ensures long-term success. At the first consultation, honesty is key. We must explain treatment timelines, compliance with 22-hour wear, the role of elastics, and the possibility of refinements. Attachments and auxiliaries are often needed, and retention must be planned from the very beginning. Over the past 10-15 years, orthodontics has shifted dramatically thanks to digital technology and clear aligners. While virtual treatment planning tools like ClinCheck help us visualize cases, biology doesn't change. Tooth movement still follows natural tissue dynamics. Key reminder, treatment success depends on patient compliance, realistic planning, and the clinician's understanding of biomechanics. Let's begin with non-extraction class 1 malocclusion. When managing crowding, we typically rely on 3 strategies. In Class I crowding, space can be gained in 3 ways: by expanding the dental arch, by proclining the incisors, or through interproximal reduction. Expansion must respect bone limits. Proclination is effective when tissues are healthy, and IPR is reserved for selected cases due to its irreversible nature. 1. Arch expansion, but only within the limits of the bone. 2. Incisor proclination, which is effective when gingival health is good. 3. Interproximal reduction, or IPR, used as a last resort because it is irreversible. Each of these strategies can be simulated digitally, but in practice, results depend heavily on biological limits and tissue resistance. Again, Class 1. Malocclusion space gained by 1. Dental arch expansion, predictable only within bone limits. 2. Anterior proclination, effective for retroclined incisors. 3. Interproximal reduction IPR, last resort, irreversible, used cautiously. Now, Class 2 malocclusions. Here, the staging strategy is crucial. We can use sequential distalization of molars, elastic simulation patterns, or en masse movement. Compliance with Class 2 elastics makes all the difference. In younger patients, we can even take advantage of growth spurts, using tools like precision wings on Invisalign Teen to posture the mandible forward. With good timing, even a full unit Class 2 correction is possible. Again, 3 staging strategies: sequential, elastic simulation, or en masse movement. Compliance with elastics is critical. Growth potential in adolescents can be used to advantage. New tools, precision wings for mandibular advancement, Invisalign teen. For Class 2 correction, staging strategy is everything. Options include sequential molar distalization, elastic simulation, or en masse movement. Class 2 elastics are critical, and in adolescence we can harness growth with mandibular advancement features like precision wings. With the right timing, even full unit corrections are achievable. Class 3 malocclusions are often trickier. First, identify if there's a functional shift. If the patient can posture forward into an edge-to-edge bite, prognosis improves. Correction strategies include Class 3 elastics, lower arch IPR to retract dentition, or increasing upper arch length. In more complex cases, temporary anchorage devices, or TADs, provide additional anchorage. Remember, diagnosis and case selection are critical here. Again, Class 3, malocclusion trickier to manage. Key steps: identify functional shifts, edge-to-edge bite better prognosis. Use Class 3 elastics, sometimes combined with lower IPR or expansion of the upper arch. In special cases, TADs and molar distalization are used. Class 3 malocclusions are trickier. If a functional shift exists, prognosis improves. Correction may include Class 3 elastics, lower arch IPR, or increasing upper arch length. In difficult cases, TADs provide anchorage for controlled distalization and camouflage treatment. Extraction cases are the most difficult to handle with aligners. Unlike fixed appliances, aligners don't have rigid brackets and wires, making three-dimensional control challenging. Common difficulties include insufficient anterior torque, deep bite correction, and rotations in severe crowding. That's why auxiliaries such as elastics, TADs, or even sectional fixed appliances may be needed to achieve the desired outcome. Most challenging with aligners. Difficulties include insufficient anterior torque, trouble with deep bite correction, rotations in severe crowding. Often need auxiliaries, TADs, elastics, sectional fixed appliances. Extraction cases are the toughest with aligners. Without rigid brackets and wires, 3D control is harder. Problems include loss of anterior torque, deep bite relapse, and difficulty with rotations. Auxiliaries such as elastics, TADs, or sectional fixed appliances often become necessary. Planning case selection is vital. Bone density, age, dental anatomy matter. Attachments improve control, optimized versus conventional. Compensatory movements, extra root torque, intrusion, mesial distal tipping, are programmed to counter aligner limitations. Attachments, small composite bumps bonded to teeth, are key in aligner therapy. They increase surface area contact and help with movements such as intrusion, rotation, and uprighting. Compensatory movements must also be programmed into ClinCheck, for example, adding lingual root torque to incisors during space closure or adjusting root tipping near extraction sites. Without these, aligners can easily dump teeth, deepening the bite or opening posterior contacts. Attachments are the unsung heroes of aligner therapy. They guide complex movements like intrusion, rotation, and uprighting. In extraction cases, compensatory movements, such as extra torque, root tipping, and bite ramps, must be programmed to counteract aligner limitations and prevent unwanted effects like dumping. Let's look at 3 examples. Class 1 case: 4 premolars extracted in a bimaxillary protrusion patient. Attachments and elastics guided space closure and profile improvement. Class 2 case: 2 upper premolars extracted in an adolescent. Class 2 elastics controlled anchorage while retracting incisors to improve facial aesthetics. Class 3 case: 2 lower premolars extracted in an adult with crowding and crossbite. Camouflage treatment with Class 3 elastics helped achieve functional occlusion without surgery. Class 1: 4 premolar extraction for crowding or bimaxillary protrusion. Class 2: 2 upper premolar extractions with elastics for profile improvement. Class 3: 2 lower premolar extractions for camouflage when surgery isn't an option. These examples show that aligners can manage even complex cases, but only with careful planning and compensatory mechanics. Let's review examples. First, a Class I patient with bimaxillary protrusion, treated by extracting 4 premolars and retracting incisors. Second, a Class 2 adolescent, upper premolars extracted, elastics controlling anchorage, improving the profile. Third, a Class 3 adult, lower premolars extracted for camouflage, supported with elastics, achieving functional occlusion. These show aligners can succeed with complex cases if planned carefully. So, what's the bottom line? There is no cookbook formula for aligner therapy. Each case is unique. Success depends on 3 pillars: patient compliance, biological limits, and clinician expertise. Digital technology is powerful, but orthodontics remains a science and an art. With knowledge, planning, and experience, clear aligners can deliver excellent outcomes for Class 1, 2, and 3 cases, both extraction and non-extraction. There is no cookbook formula for aligner treatment. Each case depends on biology, compliance, and clinician expertise. Digital tools are powerful, but orthodontics remains both a science and an art. The clinician's knowledge of biomechanics and careful planning makes all the difference. The take-home message: there's no universal formula for aligner therapy. Every case depends on biology, compliance, and the clinician's expertise. Digital tools are powerful, but orthodontics remains both a science and an art. With knowledge and planning, clear aligners can transform smiles in Class 1, 2, and 3 cases, with or without extractions. Thank you for joining today's lecture. Don't forget to review this material, and let's continue mastering orthodontics together. Thanks for listening. Stay tuned for more orthodontics deep dives. Don't forget to subscribe so you won't miss it.